Good morning. My name is Maria Aranda. I'm the lead researcher for the USC Southern California Caregiver Study. Most of you in this room are participants in our study, the USC Southern California Caregiver Study. Because of you, we are here. The sacrifices, the love, the caring that you've shown your loved one through the years is something that we can never forget. Because of you, your loved one has a better quality of life, and we need to celebrate you. We're also here to talk about the study and some of the preliminary findings. One of the things that USC is very much dedicated to is the fact that we want to not just conduct studies in the community, but also to be able to come back and say, these are some of the things that we found. And today I'll be giving information on some of the data that we collected based on your experience as well.
My name is Rio Fujita, and I take care of my mom that's 80 years old. She was diagnosed with dementia 9 years ago or so. I'm the primary caregiver, and that's what I do.
I care for two individuals, my mother, Teresa Sanchez, and my brother-in-law, who recently passed, Lázaro Cruz.
I'm the caregiver for my wife, Artemis, who developed memory issues about 2 to 3 years ago.
Tengo cuidando a mi esposa, pues ahora digo que es el privilegio, pero porque ya he aprendido, pero ha sido un proceso muy difícil.
I am caring for my mother, who is 82 this year, and she has advanced, she's in the last stages of Alzheimer's.
Yo cuido a mi mamá, que tiene 96 años y está ya en la etapa intermedia avanzada de Alzheimer.
And we also want to be able to document who we are, what we do, not only us as researchers and our researcher team, but also the caregivers in this room. And lastly, we want to open up opportunities. If you're interested in participating in any future research opportunities, we have some research opportunities that we will talk to you about later on today. We're here because of you, our caregivers, but we're also here because people had the right state of mind to say, USC is putting on a study or wants to put on a study. We need funding for that because this costs money to do, as you know. So we have received funding from the California Department of Public Health, Alzheimer's Disease Program. They are the ones who funded our studies. Because of their forward vision, we are here today as well. The other people I'd like to thank is the Alzheimer's Los Angeles, who was our community research partner, the Los Angeles County Aging and Disabilities Department, and the USC Alzheimer's Disease Research Center. We just started a community advisory board, and this advisory board has the task of helping us understand what are the next steps. What are the next steps in terms of research? What are the next steps in terms of helping people that are affected by dementia, affected by memory loss, subjective memory concerns? So what I'd like to do is call up our advisory board members. Nora Manzanilla, she cared for her father. She cared for her mother, Gladys, for a number of years. Her mother passed away last year. Nora is really the epitome of a caregiver. But there's another person in Nora's life that is not here today. She was supposed to be here, but now she's caregiving for her father who had a recent hospitalization. Her name is Dalia Zamudio, Nora's daughter, who's how old?
She's 17.
17 years old. So here we were going to give her an honorary caregiver certificate, but she's not able to be here today because literally she is caregiving for her father at this point. But we'd like to give this to you in honor of Dalia Zamudio, the youngest caregiver in our group.
Thank you. When I look around this room, what I want to say is I have gratitude because when I see your faces, I see myself in you. And so this is so much about connection and how we are all connected. But we are all connected by love. We are connected sometimes by our faith. We are connected so much by our journeys. And I hope that today we can share so much of our journeys and so much more of what we need to do. The impacts that this disease and memory care impact our lives, impact our professions. If we have jobs, this takes over our jobs. And sometimes even in our workplaces, family medical leave is still not well understood, and there is a stigma to it. There is a stigma as a professional, there's a stigma as a woman. When you look at how much sick time women have versus men when they leave the workforce, my boss has 1,000 hours of sick. I have maybe 96. So I'm so happy to be here and share and learn, and I look forward to the rest of the day. Thank you.
Sometimes people in big places is because they are people who have done big things. And Dr. Laura Trejo is one of those persons. She is the first director of the Los Angeles County Aging and Disabilities Department. She was appointed by the Board of Supervisors in this capacity, and she oversees programs and service delivery for older adults and adults with disabilities, including Adult Protective Services, the Area Agency on Aging, and the county's 14 community and senior centers.
Dr. Aranda told you about my work, but I know that she invited me for a very different reason. In my regular job, yes, I am the Director of Aging and Disabilities for LA County. I'm very proud to do that work on behalf of all of you. But she told me when she called me that the reason that she would let me come and talk to you today was because I share something with you. I too am a family caregiver, a serial family caregiver at this point. I help take care of my grandmother. I help take care of my father. And now I'm taking care of my 87-year-old mother, who actually happens to be in the hospital today. It's what we do, right? Caregivers have to be very flexible. And you can't let it get to you when something happens. You go, okay, now how do I need to reevaluate my day? And you keep moving. That's what caregivers do. We're very flexible and we're very intentional. But that's one of the reasons that Dr. Aranda invited me today, because she wanted to make sure that I shared with you that family caregiving to me is not a concept that I read in a book or a program description that I write in a website, but it's something I live with every day in my own life when I'm trying to figure out what is the best that I can do to take care of my mom. It's important to me that as family caregivers, we do these kinds of activities, that we come together, and that you look around, you're not alone. Because when we're taking care of somebody we love, sometimes it gets very isolating, and we forget that we're not alone, that there are people trying to be out there to help you. At the County of Los Angeles, we're there for all of you. We have a lot of different services and supports. And one of the things I'm going to ask each and every one of you to do, because you were here today, now you know that there's a Department of Aging and Disabilities. Tell people in the community, tell your family members, tell your friends that we exist. Even if they don't need us now, if they need us later, I want them to know that they're not alone and that they can reach out to us.
I try to encourage my sister, who is the primary caregiver to my mom, to participate. And I also have a friend who cares for her cousin who is suffering from dementia. And so now I'm going to go back and tell them to absolutely enroll in the study, because it really is important to give their input and to for them to be aware of services to help them to care for their individual family members.
Yo participé en el estudio porque primero era gratis, segundo me gustó la experiencia, tener una nueva experiencia y la sed de conocimiento de la enfermedad. quería saber más de la enfermedad para poder entender a mi paciente.
Soy una mujer bendecida de Dios porque cuidamos a mi mamá entre todos, mis hermanos, todos tenemos un día y por eso es que estamos en el grupo para aprender más sobre la corta memoria. Esto a nosotros nos dolió mucho. La decisión en realidad fue por amor, porque cada quien dijo, yo puedo viernes, yo puedo sábado, yo puedo domingo. Fue así, no fue decisión obligada, fue amorosamente por mi madre.
I realize how much I keep this journey private from my friends and you know, my really close friends who I've had forever. And so what being involved in the program has taught me is just how can we get this information out to the wider public, that it's available. You know, that like not everyone Googles and then takes action on the information that they get from Google. They're maybe just consuming that information from their home and then not doing anything about it. So it's like I just think it's so important to know that you're not alone. It's the only way you can really make it through this life is with community.
Yo participé en la celebración de abril porque me sentía orgullosa de haber recibido un certificado de allí. Lo mejor que fue en español, fue en mi idioma, y conviví con muchos pacientes, familiares de pacientes, y sentí pues la empatía con ellos porque también tenía mi paciente. Entonces fue por voluntad propia y sí, por conocer más de las personas que cuidan también sus familiares.
Every day, as a family caregiver, we get given the gift of spending the time with our loved ones, sharing our love, lifting up our families, lifting up our communities, as we're providing that level of support. So know that you are the heroes every day in your own households, in your families, and in our communities.
So we know that the phenomena of caregiving is universal. We will find ourselves in different roles and different sides of this fence of caregiving. So everybody here will be touched by the phenomena of caregiving for a family member or other close other. We know that almost 7 million people live with memory loss or dementia in the United States today. By 2050, someone in the USA will develop dementia every 33 seconds. That's going to affect upwards of 13 million people. And more than 11 million Americans provide unpaid care for a loved one with dementia, people like yourselves, caregivers. And these family caregivers provide the lion's share of care and assistance to older adults and persons with disabilities in the USA. What is needed for the journey? Knowledge, skills, and attitudes. So a caregiver needs knowledge. They need to know, what is memory loss? And so many people in our study said, I had no idea what this was. And now I know better. Now I'm prepared. I know now that this is dementia. It's not aging. It's not schizophrenia. It's memory loss. We see that from baseline to the first follow-ups that people reported that their health was better as a result of participating in the classes. So we're seeing some good trends there, right? People actually said that they got better.
I learned something new. I learned that caregivers are persons, they're people too. They have feelings, they get exasperated, but for some reason they're so resilient in that they triumph. And that power and that willing to caregive and the love that they give to their loved one is amazing. I would never ever dreamed of meeting such wonderful participants and watching them go through the journey.
There's no guidebook. You know, we didn't know what was going on with our mother. We tried several times to like have her doctor help with diagnoses, but unfortunately, like our parents you kind of keep it as a secret. You know, you don't really admit that you're failing or that like your loved one is failing or their brain is failing until it's too late. And then suddenly you're thrust upon, and like my sister really had to learn with like a looming sword over her. And I think when we actually moved our mother independently from Alaska to California, that's when we realized how bad it was. And unfortunately, it was too late. So I think hearing that people just don't know what's going on or don't understand it until it actually happens is society needs to like remove the stigma of dementia, mental health issues, that it's okay to ask for help and not wait until it's too late.
It gave me a sense of understanding that I'm just not the only one, and there's this support group out there.
I learned how to speak. I learned how to reach out, and that is very important to a care provider. You have confidence that this is not easy job as a care provider. And I learned there are resources, there are caregivers like me.
The most rewarding part of me being the contact person is when that person would call in, they were exasperated for whatever reason. And at the end of our conversations, they would say, "Thank you." And I didn't do much, I just lent an ear and understood and maybe gave them some recommendations or suggestions of how to cope with the issue that they were experiencing at that moment. Sometimes I gave some great suggestions that they never thought of, and they thanked me. And that was rewarding and the best part of my job.
Really appreciate that there's this group out there that's appreciating us, because we're doing the caregiving job 24/7. It feels very lonely. You get isolated just taking care of the person you care for. I enjoyed that we came together as a group and celebrated as caregivers.
It was a community sharing a common thread, which was caregiving. Caregiving for that disease, Alzheimer's disease.